Good afternoon, everybody. I had never heard of the drug court until a couple of months ago, and I need to learn more about this. And I went to visit their board meeting and went to visit a court session, and I was truly amazed at the work they do to try to help people, to try to save lives. Noel Bagwell is the director. He has several years with the Cushing PD and the Sheriff's Office, 16 years in treatment. And I'm going to introduce Noel Bagwell, the director of Payne County Drug Court.
All right. Thank you for having me today and giving me a little opportunity to talk about drug court. It's one of the things that's been here about 30 years, and it's something that's just kind of quietly went along and not much attention's been drawn to it or not for several reasons. But I brought some notes to try to stick with that because I could talk about drug court all day and we could be here all day, so try to stay on a little bit of script. The drug court program was started in 1995 under the district attorney's office at that time for a period of about 4 years. During that time, I transitioned from the Cushing Police Department to the county sheriff's office and got back. I took a week's vacation, come back, and walked in, and then Sheriff Heiner told me to go down and see the district attorney. He's got something he wants you to do. So I'm wondering, okay, what to do, what I need to do different or whatever. But I went down there, and then going down there, I met, at that time, the assistant chief of the Stillwater Police Department, Ron Thrasher. He was going down there too, and I said, well, what are you doing? He said, well, I'm supposed to see the DA. So we get down there and meet with the district attorney, and the assignment was, and the request was, we have drug court. We're not getting very far with it under the way we are doing now. So we formed a 501c3 nonprofit, and we've charged you two and one other with the duties to either make that thing work or we need to do something different. So we took that challenge, which at that time was challenged because it wasn't any money. It wasn't hardly any money for any of that and nothing to substantiate the operations of it. So we started in, and that's been September of '99, started in doing that and created a program that I think is the very best in the state of Oklahoma. The drug court board is comprised of 6 people currently, and those people have different backgrounds. Most are retired. As I really paid attention yesterday at our board meeting, everybody was introducing us to some other people, and the common word there was retired, so I'm one of about 2 that's not. But those people have 85 years experience between them in one. We have one person, the one that was at the DA's office with me, that has been in 49 states, either assisting drug courts in other states to start a program or improve their program, and still works today, but glad to tell me that he's retired when I call and ask for assistance. The program is not a one-person operation. It takes a bunch of people, different people. People start out in the district, their case gets, and you have to be a defendant in a criminal case to get to participate in drug court. That starts with the district attorney's office looking at what the circumstances and they will send us referrals or information for us to review someone and do assessments of those people. And then we go back with a recommendation that yes, they're within their parameters. We have to meet some state parameters and things, but whether they're in the parameters of situations and whether they would benefit from the program and actually have a addiction issue. Once they get past that, they're ordered to the program, They get report, and their first appointment, they've got about 80. We have about 80 at the intake packets, like 85 pages long, to where they're doing some just assessments, self-evaluations and stuff, plus their personal information, medical issues and things like that, because we will see sometimes that people have prescription drug abuse problem in addition to just illegal drugs within the system. So once we get them started, they start into a 13-month program, and that's if they don't have any mishaps, or they just hit everything like they're supposed to. They can complete it in 13 months. Their phase one, they initially will appear before the drug court judge. After that appearance, and they start group counseling, individual counseling, random UA urine tests, and those are drawn by computer. Computer will randomly pick you out to provide drug tests for that day. And depending upon, as long as you're negative, there's not any problem. You get incentives and things. When you start having positives, we have a kind of a small graduated sanction list. It starts with community service and can go into county jail time for 3 days per the offense, or depending on what it is. Or we can reevaluate where you're at and get you in, set you down with one of the counselors and put them in inpatient treatment in one of the facilities in the state of Oklahoma. Then after that, they move into phase two and work on relapse prevention and get tools to learn how not to relapse, or we hope they learn not to. Phase three, or also in phase two, we have a life skills class which teaches them everything from budgeting to how they just generally deal with everyday issues. The counselor, or the person that teaches that, was a career criminal, for the lack of a better term. I dealt with him numerous times at the sheriff's office, city of Stillwater. Everybody dealt with him. Been to prison 2 or 3 times, got in trouble. And at the onset, nobody wanted to give him a chance, and rightfully so. But we got together as a team and got the judge involved and everything else, so we give him an opportunity. He took that opportunity. Not only did he do the program in roughly 13 months, he has now come back, got education and certification through the state of Oklahoma to do peer recovery support work with the current clients, linking them with services in the community versus what we have at drug court. He's also took and rewrote the life skills program and presented it more on a level that the clients that are taking that understand, and not just a book. He actually talks from experiences. He's lived it. That class is probably one of the higher rated classes in our notes that we see. And just in the last 60 days, he's obtained his case management certification from the state of Oklahoma. So it can work, and it does work. And the days that I get kind of discouraged of we're just one thing after another, I think, okay, Eric has done it, and we're doing good with it. So he continues to do good. I think he'll continue to be a good employee and a good person that can help people, on a one-to-one. If I understand where you've been, I've been there. So then you move on into a moral recognition therapy class, which gets a person to it kicks all that deal is work on your own. We have it in two phases, or 20 weeks that you work on yourself. You have weekly classes, and it's a self-evaluation program, but you've got to put it in context with the curriculum and give up and start looking at things you do within the program and how they affect your life. It also deals with recovery therapy. How are you going to stay sober? How to work toward that. And then the final stage is titled You After Therapy, or the recovery goes on beyond stopping the use. So it's an everyday. We want them to understand they can't walk out there. If they walk out of there with, I've got this whip, I'm not going to have this problem again, they're going to fail. The stats that just showed us they're going to fail. They have to realize this is a daily experience for them from now on. And how they deal with that is what their outcome is. We have about 72% of the people that go through that program are successful. We don't see any involvement in the criminal justice system, or police aren't calling me saying, hey, did you know so-and-so's, they contacted you? Because we tell them when they graduate, contact, if you have a problem, come in the door, pick up the phone, contact us, whatever. But if you 5 years, that rate's based on a 5-year summary that we don't see them back in the judicial system or anything like that. One of the other things I was talking about, that employee that has done, he is currently working on and building from scratch what would be an alumni, drug court participant alumni associate that will meet quarterly and then have an annual meeting and get together, just so everybody can kind of see that how they've moved on. When you get into phase 4, toward the end of it, it's relationships, because sober relationships and addiction relationships are very contrastly different. And it goes into, you have to change your people, places, and things to, you got to get away from the old life to make it easy to succeed. One of the other biggest things is they're subject to drug testing 365 days a year, 7 days a week. They have to call a hotline starting at 6 o'clock in the morning, and to find out whether they have to test or not. If they have to test, they must report to the office by 8:30 a.m. and no later than 10. If they do not report by 10 o'clock, or we've not heard out of them and made exceptions, which are very few, they will face an automatic 3-day jail sanction for that. They could do a drug test in the morning during that time, leave, come back in the afternoon for a class or just anything, and be told test again. Usually that second test for the day stays clean, but we've had a few that they've tested of a morning, and then before they come in of afternoon they've used, and thinking they're not going to get tested. So we're steadfast on that. That is the hallmark of the program. You've got to maintain sobriety. When you get into phase 5, you have a period of time that another PRSS that was been through the program previously and obtained her PRSS certification conducts a phase 5 class about life, preparing for life after drug court. It's a very one-on-one. It's group, everybody all kind of gets in, and it's another one that I think is our second highest class that they want to, or they participate in and do things. And then of course during all that, in the first 2 phases, you're going to get to see the judge, which will be Judge Thomas in January, I'm told. They're going to get to see her every week, every Thursday in the first 2 phases. In phases 3 and 4, that drops to every other week, and in phase 5, it drops to once a month. At any time in those, if we notice that there's problems or incentives, then we can adjust the plan to do that. She once again is the final decider on, do we sanction somebody, do we send them to treatment or whatever. It's 30 years. The city of Stillwater's been with us in some form or fashion for 30 years. It was when it began to now. They continue to be. We actually, just in the last week or so, have learned we are going to be a recipient of the opioid grant monies through the city of Stillwater and through the state attorney general's office. So we're now working on a couple things we've got to get done before it's formally awarded. But that program looks to put another level of drug court. Not, you won't be in drug court, but we have a sister company that does supervision, and that's you got to, whatever the court orders, you got to do everything they say, whether you have a substance abuse problem or whatever. It's work on your own. We hope to take that and offer to those people some treatment and options through that grant money to help with their help them with their drug addiction, or specifically opioids. We see a lot of those. We still see drug court fentanyl. Fentanyl is a terrible problem in this county, and everybody's working to stop it. But we have people come in, and we'll ask them about their drug test. Well, you're positive for fentanyl. Well, I didn't take fentanyl. I took the meth, but I didn't take the fentanyl. The question then becomes, did you ever think somebody's lacing the methamphetamine with fentanyl so their product's better than the previous guys, and he can sell it more? In talking with the police department, Josh and I should have a hotline between us, because we both talk quite a bit about what's going on in the communities, and I've talked to other law enforcement agencies, and he keeps me up on that. Fentanyl is everywhere, and it does not take much, to cause you to pass out or die. We're hoping we can change one of that. If we change one of those, it's been worth it. So we'll work on that and can move forward, and hopefully January, I think that was, we'll start seeing the benefits of that. The program is paid for by state contracts, very low rate of 30%. And we see, of course, they're through the Department of Mental Health, and so they're working to get their problems resolved too. But we've seen an initial cut this fiscal year of 25%. The payment for programs costs about $6,000. 30% of that comes from through Department of Mental Health contracts. 2% comes from Department of Corrections, and that's just because they have a lower number of people in there. But the clients pay 33 to 35% of that cost of that program and they should pay something. I'm not sure that, I think there's belief amongst the drug court teams and people that should not be that high. And then we also have a commercial side of operations that we do drug testing for some businesses in town, courts, Department of Human Services, that makes up the balance of the 100%. So this again, with getting that grant with City of Stillwater, will kind of help level that out as well. I don't think the drug court team's a district judge, or currently the district judge, or a judge of the courts, a representative from the DA's office, representative from the defense counsel for the county, mental health provider, myself, and a treatment provider that is actually through drug court as well. So those people each week get together about 45 minutes before court, and we discuss each and every one and get different views. And everybody, when we're in there, it's not somebody the ADA is not being an ADA, the defense counsel not being defense. We're actually looking, okay, this person's doing this or that or whatever, and talk about them. And then when we get done with that, we go into court, which then they are called up by the judge to see how the week is going, any concerns that we've talked about, any services that we could provide from those members sitting there at the front of the drug court team. And if they have legal questions, clients have legal questions from other cases that are not involved in drug court, we try to clear all that up while they're in the program, so that they don't have to worry about it later. And I think that those are stressors. If you go through the program but you still have a case in Oklahoma County that they're trying to put you in jail or something, we'll try to get that resolved while they're in the program, so they don't have to worry about that when they get out. So some of the demographics: 77% of the people in the program are male, 23% are female. It was not too long ago, probably 5 years, that 10% were females and the other 90% were males. Not quite sure what has shifted that number. Average age at admittance is 37. They have a 35% are working full-time jobs. 55% do not have a job. We've got a pretty good base with local businesses in the town that it's restaurants or fast food that they can go there and work. So we get them off the unemployment, which in the long run saves the state money. We get them, if they're behind on child support, we work with them to get their child support case on the positive side instead of just not doing anything. They have court costs, restitution to victims of their crimes. So that all gets worked on and started in a positive mode to that way it removes the stress and the relapse and constantly turning around looking behind your back or the police coming for me. This last fiscal year, it was kind of interesting. The alcohol was the top drug that would get you in the program. Then methamphetamine, and then the increase. We've seen fentanyl and some opioid increases that we definitely want to get stopped. We actually operated in Payne and Logan County. Logan County Drug Court's a little different because we have a different treatment provider over there, but the rules are still the same. So between those two counties, we'll easily make 72% success each year. So program it's a real good thing, but it takes a lot of people to make it work. Of course, we've got a new DA and a new judge incoming. I worked with both of them back in law enforcement, with the judge in law enforcement days, and Jeremiah and he was previously on the board of drug court and has extended his support. Both have extended their support for drug court and what our future brings. So we hope that we're here for another 30 years. Just I won't be there to see it. If anyone has any questions, I'll be.
I just want to note for the audience, I did serve on the board of directors and enjoyed that. But I do want the group to know that the reason we have a drug court that is still solvent and still running today is because of that man standing right there. I'm not saying it just because he's standing in the room. We have gone into insolvency, almost gone into insolvency multiple times. And I have watched Noel nickel and dime what little money we had to get these drug addicted individuals through the program and make them drug free. If Noel hadn't been the executive director, we would not have a drug court today. That is the truth of it. Judge Thomas is also can verify that. The other thing I want the group to know is that the personnel that work there, we've got Josh, who's a part of it. We've got Noel, we've got Eric, we've got all the Dane. They're not just helping them with their addiction. They're helping them with life skills. They are not just saving their lives. They're teaching them how to live. Josh is going out there and he's rooting for him. He's going to their house. He's providing him coaching. And he's like, man, I want to see you in public and shake your hand, not put handcuffs on your wrist. Noel, he does some tough love, but at the end of the day, people are succeeding because of that group. That's why our success rate is so incredibly high. But one of the biggest burdens that we have with drug court is we're putting the burden of the cost on the client, on the addict. It's why I've advocated and said we need to get rid of DA fees and court costs for indigent people. We need to make this program where it is 100% funded publicly and not by the drug addicted person. Because yes, they get clean, but then they're saddled with all of this debt that they owe to drug court. And that's how drug court's having to operate. The state makes us have to collect those funds. It's not fair. So if you guys want to take an active role, call your legislator. I already know Trisha's on board, but we need to call the other legislators throughout the rest of the state and tell them there is a spillover effect. Yes, I'm all about being conservative and being a good steward of taxpayers' money, but there is a huge spillover effect. When we invest in this, we are saving people's lives. We're getting back into the workforce, and we're actually growing. Economically, we are growing whenever we save these people from addiction. So please call your legislators, talk to them, and tell them, hey, We need these programs funded because they're making our community safer. People are dying from fentanyl. You guys can go up and touch it on a doorknob and it can potentially kill you. It's a spillover effect. If we can get people off those drugs, we are saving the lives, not just their lives, but potentially the lives of our own children. So please let your legislators know we need this program funded. So I don't have a question. I just wanted to back you up.
There is an actual question on this side of the room.
What is the youngest client that you have in
You
court?
have to be, at current time, has to be 18 or older, and you have to be in the district court system. We, several years ago, did a juvenile program. When we did that, 10 to 12 could be the youngest in juveniles. We had to discontinue that because of funding. We never had any state funding at all for that, and was having to put it on families, and it just got to the point that it was cost prohibitive for that. For the
So is
people
there
to do
not a
that.
program for those under 18 right now?
Currently, no. And that's sad.
Two questions.
Okay.
What is the success rate
72,
of
average is
repeat
72%.
that? So you've got about 30% repeat offenders.
They're 28%. We'll hit 72% and stay pretty consistent with that. So 28%, and most of those have just did not take the treatment that was provided for them, or got new charges, or just got terminated from the program overall.
That's sounds good. The other question I had is statistically, when you do your random sample and you start getting an increase in exceptions, do you increase your testing of the population?
Yes. We'll either increase it on an individual basis. If we just have one or two that we've seen just an uptake, we will increase their testing. If we see, say, 5 or more, we will usually increase the testing of the whole program.
And then how many bad tests do they have to have before you run them back to the county?
That's a hard question because it's not a simple answer of you just mess up and you're before the judge and you get put out. This morning,
You don't have to make that decision. You just report it.
we reported as the team that I talked about earlier will decide. The judge has the final say on what to do. This morning I had termination hearings on 4 people for various infractions. One was because of new charges. The other one was that they went to, we increased testing. We'd done everything, sent them treatment. They left treatment and then didn't show up. 2 just didn't show up when they were ordered to show up. One we don't have a decision on yet. Of the other 3 that deal, those people they're taken under advisement for a period of time, and they will more than likely be allowed back into the program on a 60-day trial to see if they can abide by the rules.
Thank you.
Thank you so much, Noel, for your very informative presentation.